The basic pathophysiology of degenerative cervical myelopathy involves hypoxemia ischemic cascade, which leads to generation of neuroinflammatory mediators, which in turn cause neurological sequelae. So this is where the role of cerebrolysin comes in, as is well known that the gold standard for moderate to severe cases of cervical myelopathy is decompression surgically, but there is no approved drug which has been studied for the management of cervical myelopathy. Now, cerebrolysin is a product which is obtained by enzymatic degradation of fat-free pig brain and contains a number of growth factors like brain-derived neurotropic factor, insulin-like growth factors 1 and 2, and nerve growth factor. It has 3 vital properties which makes it very useful, that is neuroprotection, neurotropism, and neuroregeneration. It has been extensively studied in neurodegenerative disorders like Alzheimer's and Parkinson's, but there is only one study till now which has studied its role in degenerative cervical myelopathy, and that too was studied in a cohort of patients which were managed conservatively. In our study, in comparison, we studied the patients who were operated and were given injection cerebrolysin. The study was a prospective double-blinded randomized control trial with the patient and the assessor blinded to the treatment. A total of 60 patients were enrolled, of which 2 groups were made. One was given injection cerebrolysin and the other was a control group. This is the treatment protocol. Injection cerebrolysin was given 5 ml diluted in 100 ml of normal saline over 30 minutes, once a day for 21 days post-operatively. In comparison, the control group was given 100 ml of normal saline for the same duration. The data were collected at various intervals, and the assessment was done on clinical, radiological, and functional criteria. These were the results. We obtained a mean follow-up of 20 months. The distribution of various criteria across the 2 groups was not significant. A total of 30 patients, of which 28 male in the cerebrolysin and 2 females in the cerebrolysin group, and 26 males in placebo and 4 in female were studied. With respect to the surgical approach, 30 patients were operated by an anterior approach, 29 by posterior, and 1 by a combined anterior plus posterior approach. With respect to the functional outcome, the VAS scores improved significantly at 3 months, 6 months, and 1 year in the group given injection cerebrolysin. Similarly, the modified Japanese Orthopaedic Association score for cervical myelopathy improved at 3 months, 6 months, and 1 year in the injection cerebrolysin group. More importantly, the hand function improved in a statistically significant manner with a p-value of 0.03. The neurological recovery was also better in the cerebrolysin group, but it was not statistically significant. More importantly, there was no adverse reaction to injection cerebrolysin. These are a few images of the patients that we had operated upon. As seen, the myelomalacic changes had decreased by the time the patient came for follow-up. Now, we reviewed the literature and could find only one case series of patients given injection cerebrolysin for cervical myelopathy. However, a lot of papers were found on the effect of cerebrolysin in neurodegenerative disorders and including head injury patients. This is the study which was done in the cohort of conservatively managed cervical spondylotic patients. In our study, we did not observe any adverse reaction in comparison to them, and the neurological recovery was also better as compared to their paper.